So my name is Saram Marzoub. I'm a resident in psychiatry and part of the comedy organization. It is so great to see the turnover this morning on a Sunday morning. Um, just a reminder that sometimes there will be interactive polls in some sessions, so look out for these and participate. And you can earn point for engaging in various aspects of the virtual conference for your chance to win a complimentary registration for the 5th Canadian Muslim Mental Health Conference, inshallah, or one of two $25 gift cards to Amazon. Points are awarded for actions such as answering poll questions during session, posting about the conference on Instagram, Facebook, Twitter. You can use the hashtag CMMHC2020, and completing the course evaluation form that will be sent to you at the end of the conference. You should have received the form for yesterday already. For today, you need to complete the course evaluation form to get accreditation. So if you are looking for those credits, please do complete the course evaluation form that will be sent to you after this conference. Speakers are happy to answer questions during the Q&A period, so post them in the Q&A. For general comments and questions for our the organizer, you can ask them on the comment section. Um, so again, the session on December 13 are accredited, including the research poster session that will follow up this session. And I remind you that resources are available at www.muslimmentalhealth.ca. So I will start with the objectives of the session. The objective of the sessions are to summarize examples of Islamically integrated approaches to mental illness, illustrate Islamic approaches to coping with distress, and identify and discuss the impact of maladaptive spiritual practices and explanatory models of mental illness. And it is my great pleasure and great honor to introduce Dr. Rania Awaad, who is such a model for us who works in the intersection of religion and mental health. She's a practicing psychiatrist based at the Stanford University School of Medicine. She's a clinical associate professor in the Stanford Department of Psychiatry and Behavioral Sciences, and she pursues her clinical practice through the department's community psychiatry track. She's also a researcher, and she's a director of the Stanford Muslims and Mental Health Lab, where she mentors and oversees multiple lines of research focused on Muslim mental health. She completed her psychiatric residency training at Stanford Hospital and Clinics, where she also pursued a postdoctoral clinical research fellowship with the National Institute of Mental Health. Her research and clinical work are focused on the mental health needs of Muslims. She has been the recipient of several awards and grants for her work. Prior to studying medicine, Dr. Awaad pursued classical Islamic studies in Damascus, Syria, and hold ijazat or certification in Quran, Islamic law, and other branches of the Islamic sciences. So join me to warmly welcome Dr. Awaad.
Assalamu alaikum wa rahmatullahi wa barakatuh. It's wonderful to be here with all of you. Good morning. At least it's very early morning California time, mashallah. And definitely, I believe, still morning even in Toronto. So welcome, everybody. I'm happy to be here with you today, hopefully discussing this important topic. I do need to ask the organizers to allow me to share screen, please, if that's okay. And today, inshallah, we'll be talking about kind of the coping mechanisms really related to everything we've been going through here with COVID-19 and this pandemic, and really talking about it from a both, we'll touch on the neuroscience part of this, but we'll also definitely focus on spiritual coping methods as well for, again, those of us who are Muslim mental health providers, who are Muslim community members, who are Muslim leaders, for this community as a faith community, integrating faith into the story becomes ultimately very important. So with that, it looks like I have a screen sharing ability. So if you'll give me a moment here, I'll go ahead and share my slides. And we'll be off. Here we go. Bismillah ar-Rahman ar-Rahim. Wa sallallahu ala Sayyidina Muhammad wa ala alihi wa sahbihi wa sallam ajma'in. So again, wonderful to be here with all of you. No conflict of interest to report. All right. So I normally start, my discussions with resources and end with some resources as well. So I'll do that here today first and let you know that this is my lab, the Stanford Muslim Mental Health Lab. And the website has, a lot of information about the lines of research that we conduct through the lab, and also future kind of projects that are happening. It's been a wonderful experience running this lab, and really robust number of, mental health researchers, both junior and senior. So it's really wonderful to have this as a resource, and I kind of direct you all to it and to the social media handles to follow the work that's happening as well. All right, so let us begin here and say that, the year 2020 has been quite a year. And, the play on words here, if it hasn't been quite so 2020 vision, right? It's been a difficult year, And as we look at it's really important to kind of trace, at least for mental health purposes, kind of trace back what is it exactly that happened, mental health wise, emotionally, psychologically, for communities. What was exactly that kind of trend that we were seeing that then leads us to the point we are today in December of 2020, kind of looking at, 2021. So you have, of course, the very first sense of, emotion. The first emotions that happened was a sense of loss. A loss of what? A loss of normalcy. That people were, once they realized this wasn't just a 2 to 3 week quarantine and issue, there was definitely a sense of like, but my way of life, but everything I've done and everything I have been doing, right? The sense of loss, which continues to be with us. And that's important to hold on to as we talk later about some of the tools for coping. Eventually, you see that loss of normalcy kind of also very quickly, might add, replaced by fear and anxiety, as we find that there's this escalation of COVID-19. I don't know about all of you, but certainly for me, what I've sensing in the community, I know there's a lot of people writing about this, but certainly anecdotally, what we're seeing is that this second, or this, it's been more than one surge, but this current surge, I should say, has really taken people even more fear and anxiety than even maybe potentially the first one. There's so many more cases. I know there was a number reported, at least here stateside, just a few days ago, was the largest number of people who have died by COVID, and it's been really, really difficult on folks. So it's to kind of just think about what that means, kind of going into this new year, and the fear of the unknown, the fear of what this exactly means. Will the vaccines, be here in time? Will there be enough? Will everyone get them? I mean, there's all these questions, as you know, that are happening all around the community. So I'm just sort of building up the story, kind of giving the background to kind of get us all to a place where we all already know this sense, but kind of just recapping what the year has looked like in order to talk about how to cope from here. And then there's, of course, all the other concerns beyond the pandemic that 2020 was really highlighted for. And again, I'm talking, I'm here on the US side, and many of you may be joining from Canada, and I realize that there are differences, of course, between the two countries, but there are definitely still some similarities. And for us on stateside, I mean, the police brutality, systemic racism, this, very violent, summer that we've had, and continue and have had for years and years, of course. But this has been a difficult time for many of us. And of course, again, for the US population, we've been through the elections this very recently, not fully quite out of it, I would say, but almost there. And then, of course, all the natural disasters that have happened in this year as well. So you can think about how that even the healthiest person, this will take a toll on their mental health and well-being, right?
Dr. Awaad, I'm sorry to interrupt just for a minute. Just a reminder that there is a closed captioning, so if we can just talk a bit more slowly to help them keep up, inshallah.
Aha, thank you.
Jazakallah khair.
Of course, my pleasure. All right, yes, I do tend to speak a little bit fast, inshallah. All right, here we go. And so we've talked about kind of external measures, things that were certainly difficult kind of for all of really the society and everybody around us. But then you think about, what does that tool look like internally, right? And this is the neuroscience part of the conversation. And for those of you who have studied the neurosciences, this will be familiar to you. But even for those who may not have, I'll try to break this down as in simple maybe hopefully it's not too oversimplistic, but enough of a building blocks to kind of understand what is happening inside of ourselves, right, during this period of time. And we start with the hippocampus in the brain, which is really the core memory processing center of the brain. And what that does, it stores memory. So it compares everything that's happening now, new experiences, to everything that's happened in the past. And we can agree, I think, that the pandemic is something none of us have lived through before. And so, and for that reason, when the brain is trying to do this comparison, it's finding an alarming new experience, right? Again, regardless of how mentally healthy or unhealthy you have been at baseline, this is a new experience for everybody. And for that reason, right, we are all in this together. If we kind of look at it from a neuroscience perspective, I think we can agree on that point, right? And then what happens after the hippocampus? Well, um, the brain then codes all the inputs, right? Everything that's coming into the brain as either familiar, unfamiliar, safe, dangerous, right? It kind of makes these distinctions. And if there is something that is considered to be unfamiliar or dangerous, then you have a signal that is sent, right? These neurotransmitter signals, right? That are sent to another part of the brain called the amygdala. The amygdala is known for being the place where you have the fight or flight response, which many of us, of course, have heard of. And the fight or flight response is it whenever the brain senses there's danger or something that is, again, unfamiliar territory. So even though you might just be sitting right here in quarantine or just right here kind of socially distancing from everybody who's not family and kind of just far away, and you're thinking, I have a roof over my head, I should be okay. The reality is all of our hippocampus and amygdala and structures are going through this internal process of saying, this is not familiar. I don't know this. I mean, unless you're somebody, again, I would give the example of, unless you're somebody who, had always worked from home, and you and your family had always schooled from home, and you had very few social connections outside and didn't really leave the house much, and, you know, and so on and so forth. And even then, the fact that there are limitations, or the fact that you now wear masks, or the fact that you can't be closer than 6 feet to someone else next to you. I mean, regardless, this is all new to us. So why am I emphasizing this? Because I know that today we have our mental health professionals here, but we also have, community leaders who can carry these messages to people within the community to say, look, don't belittle this, don't shame this experience, and also don't, um, sort of give, unfortunately, in the faith community, we find a lot of people giving messages of, if you have strong faith, you'll get through anything. And it's like, sure, yes, I agree that faith can be very helpful and protective for people, and research has proven this. However, we can't deny also what's happening to us as as humanity, really, right, all of us. So anyhow, we talked about the hippocampus and the memory center. We've talked about the inputs, and then the amygdala giving the, right, activating that fight or flight response that then releases this cascade of neurotransmitters and hormones that then really goes ahead and then affects how it is that we regulate ourselves, such as, our breathing, shortness of breath, tensing of our muscles, disturbing the digestive system, speeding up our heart rates, right? And sometimes, unfortunately, to the detriment of our own health, right? So all of these things might be happening. And if you're wondering, why is my kid constantly complaining of a stomach ache? It may be that there's actually underlying anxiety about everything that's happening here, right? And so then, the fact that the pandemic hasn't ended, isn't yet ending, and we don't know when it's ending, then you end up, unfortunately, with this endless stress response. The stress response is also not ending, and that eventually has a mental health toll. Whereas why we are saying to everybody, look, there are some who are going to contract COVID and unfortunately suffer from the physical symptoms of COVID. And of course, we send our prayers and best wishes of healing to all those who have, and protection, of course, for everybody's families and loved ones. But even if you don't contract the physical symptoms of COVID, everybody, everybody to some level, on some level of that spectrum, will have a mental health effect of COVID, right? And that may look like anxiety, irritability, depression, restlessness, inability to focus, right? There's so many different ways that this can manifest. And unfortunately, it could become chronic because it's already been, right, the majority of the year. And we looking into the next year, it's not quite clear how long it's going to last either. So you have this chronic, basically, lack of safety that's happening, which then, of course, makes it very difficult to, be quote unquote, keep talking about the normal and the new normal, right? Of even things like self-fulfillment from your relationships or from just, engaging in self-care and well-being. So I'm saying all this in this very early into the lecture in this discussion, because I'm realizing that all the steps I'm going to give afterwards, as helpful as they may be, ultimately, there may be more going on here for you and for those around you, that really needs to require the help of professional assistance. And that's one of the themes of my discussion today. Now, let's look at the toll. And again, because I'm on stateside, I'm kind of the research that I have is mostly on American populations, but I think this is also going to be very similar. We're talking about early on in the pandemic, nearly half of Americans said that they actually had already started feeling mental health and emotional toll of COVID. But when we started to look at specific numbers, especially in marginalized communities, anxiety and depression had more than tripled, right, amongst women, Black, and Latinx communities in this time last year, right? And that's really pointed kind of, to kind of do this comparison of what's happening. Also, if you look at the pandemic in terms of like the exacerbation of symptoms of those who already have mental health conditions at baseline. So whether that's, disordered eating, whether that's OCD, I work a lot with OCD, and I can tell you it's just, for almost all of my patients, COVID has really exacerbated their symptoms, even those who are really well under control. Their symptoms were really well under control. And schizophrenia, bipolar, and the more serious mental illnesses, of course. And then you see that, prescription medication like anti-anxiety and anti-insomnia medication went up by 21%, right, early on in the pandemic. And the helplines had also increased by nearly 50% of volume, again, in that earlier part of the pandemic. And if we turn to the Muslim community, we're looking at, of course, and faith communities in general feeling similar, strains. And in the Muslim faith community, you're finding, the lack of congregational worship. Of course, we went through an entire Ramadan and 2 Eids without being able to worship in congregation and meet with our family and friends, or maybe we should say extended family and friends. And the closure of the mosques kind of, the Muslim has the 5 daily prayers and has that month of fasting. And especially the daily prayers are, for those who are observant Muslims, they are almost like you can compare them as like, something that's holding down your day. I think about them as like if you had a tent that you were pitching a tent, right? And they're kind of like the stakes that hold down the tent, right? They hold down the day, they give it stability, and they give it order and routine and a sense of normalcy. And of course, all of the spiritual benefits, of course, of prayer as well. But when you think about how, if the congregational prayers had been in the mosque, which if that was a place where people went to for a sense of spirituality and safety, was taken away, then you can see how that also affects, right, the person of faith, how that affects their day and their like the ability to move forward. And of course, early on, when if you remember in Mecca, the Haram was closed, and we had seen all these images of like an empty, there was nobody doing tawaf around the Kaaba. It was essentially empty, and that was terrifying image for so many Muslims because it's never closed. And there's always people worshiping at the holy house, right? And so you see that kind of like sense, and it was almost like a symbolic, image of the state we were in. Um, and of course, we add to all of this the fact that we mentioned, this especially stateside, but certainly globally, there's been really a rise in the discussion of what has blatantly been there for a long time of racism. And we have to mention, of course, and this might be different again than Canadian population, but the American Muslim population, a quarter or more of the American Muslim population is Black and African American. And for that reason, when you add multiple identities and stress, you could see where, of course, the Muslim community was having a really rough go this past year. Now, if we turn to religion, I thought this was really interesting to share with you, because it really speaks to how that rise, how COVID led to a rise in religiosity. So, we're at a Muslim mental health conference, and we're talking about, of course, faith populations, but we're also talking about faith itself and religion. And to me, this is kind of fantastic, interesting, very, very important to point out. And I'm pointing it out to all of my students and residents and such, which is we cannot exclude religion and faith from the discussion. Because again, for many, even those who were not very religious in this global pandemic turned to religion. In fact, one of the studies quoted here at the end here on the American Orthodox Jewish community found, the intrinsic religiosity and trust in God correlated actually with decreased state of stress. And that is really important. And in fact, we ended up actually doing a study, which I'll present on the next slide, on the Muslim population with COVID and found essentially the same results, right? Also, the Pew Research Center put out a study early on. Maybe many of you have been able to read that by now. It was back in April. And they showed that in the American population, the sense of religion and religiosity and connection with God had risen by 24%. So, and that was interesting because, there wasn't any other similar spike in that, except that this was a pandemic now and people were kind of trying to reach onto something greater and bigger than them. And in the Muslim community, this is really what sparked the study that I'm going to tell you about just briefly, that, that there are so many prophetic, from the Prophet Muhammad, peace be upon him, prophetic traditions about the concept of, quarantine. Here he was talking about the plague, the hadith that you see here on the right, that do not enter a land in which there is a plague, nor exit a land fleeing from the plague. I mean, it's very pointed, right? And this concept of, and we have so many traditions already within the faith about when there is an outbreak that is contagious and that people are dying from and getting afflicted by, then it becomes religiously obligatory, essentially, to follow the orders of don't leave, right? So that you don't infect someone else and don't let others kind of enter in, right, in order to bring that illness in either. And this idea of quarantine. So we have a very interesting paper coming out about the mental health effects historically of quarantine, which I think is going to be very interesting to all of you, inshallah, once we publish it. But it's this concept of we have actual traditions within the faith that guides us on some of these steps. And a term that you're going to hear me say a few different times in this particular presentation, it's the term called uncertainty tolerance. So before I start talking about the actual coping mechanisms for all of us who are working either as mental health professionals or leaders in the community, this concept of uncertainty tolerance is key. And I'm going to go into much more depth about it, because it turns out that actually is the single most protective factor we found in our study that actually helped people modulate those levels of anxiety, levels of fear, and clinical levels of depression, which was really, really key to this discussion. So again, it's the ability to cope with and hold on to and kind of roll with the uncertainty that's out there. Also very interesting is in our study when we, and by the way, the study, I'll tell you a little bit about it. We surveyed 9,000 Muslims globally on their experiences with COVID over the course of 4 surveys. And they were rolled out, each survey was rolled out. One was rolled out in the very second week of the pandemic, early March. There was one that rolled out right before Ramadan. There was a third, the third was rolled out after Ramadan, roughly Eid time, and the fourth was rolled out in the summer. And during a lot of the protests and difficult things that were happening here in the U.S., and we were trying to trace basically how things were going over the course of COVID for the Muslim population. One of the most interesting findings of the study, and I won't go to all of it, but I'm just going to highlight some really key things for you to know, is that the majority of Muslims, that's a very large sample, and the majority of Muslims felt that COVID-19 was a test and not a punishment. And that's fascinating too, and really important, and perhaps even different than some other of the faith groups. And it speaks to the verses in the Quran that speak about how this world, this dunya, this world that we live in, is a world of tribulation, a world of testing. And for many Muslims, they felt like, okay, this is yet a test, another test that we have been told about in our scripture, right? That doesn't mean that people don't have fear and anxiety and difficulty with it, but they saw it more as a test than a punishment. And that was the vast majority of the sample. Also, this idea that what I said earlier about the Orthodox Jewish community, we found the same here in the Muslim community, which is that definitely there was an increase in the connection with God and with religion in general, spirituality in general. And despite those challenges, what we thought was really interesting and something we did not expect in our study at all was that 73% of the people who were in the study reported that they had a better Ramadan this year than they had last year. We've completely have thought, look how difficult everything is for Muslims in this moment. Look how difficult COVID has been. Now you're taking away the sense of this month of Ramadan, which is a very communal month. You're taking away community from it, right? For sure it's going to be difficult for people. And it's not that it wasn't difficult, it's just that people were able to see the silver linings and kind of like cognitively reframe, if you will, the purpose of Ramadan and actually say, hey, this is a time of spiritual growth and internal, turning inward and introspection. And I haven't done a whole lot of that before because in other Ramadans, because there was so much noise and people and gatherings and, out and about. And this time I'm actually, almost like forced to do what is intrinsically part of Ramadan, which is that introspection. And subhanAllah, it actually ended up being better. So that was very interesting to us. And also the numbers I was telling you earlier, when you see the numbers compared to the Pew Research Center, which is the quote down here of the 24% of Americans felt their faith had strengthened since the pandemic, the Muslim population that we had surveyed found that actually it was closer to 70% of that population, the Muslim population, reported improved relationship with God. And the only other group in all the studies that I've surveyed, that I've read since, the next higher group after the Muslim population were actually those who attended Black churches. So it's just interesting to see, like, who's holding on to faith more. So anyway, I hope this was an interesting discussion. And we partnered with the Yaqeen Foundation for this study, and it's being published, inshallah, soon in a book related to Muslims and COVID-19 coming out by Brill. So you'll have more details on this. But I give you all of this background, this research, and this data that then really drives the next part of our conversation, which is we must practice what we preach, right? Those of us, especially those of us who are in the mental health field and work with those, in mental health, we're constantly telling people, seek out care, tune into your self-care, make sure you're taking the measures, right? And even those from the faith community or community leaders, I'm sure you're saying the same things of like, take care of yourself, pay attention to COVID, protect yourself, right? These kind of things. But do we do this for ourselves? Do we do this for our own selves? Do we practice well enough what we preach? And I'm with you. I'm part of this group, right? I'm actually part of both groups. And so I think it's important to really think about, what are we doing? What are we doing when we're not working with our patients? Or if you're a community leader with your, flock, if you will, your congregants, what is it that what is it that's happening when you are in a moment of rest? Is your mind actually at rest, right? Or are you fully in the service of everyone around you and you're not really refueling for yourself? right? You're refueling your own car, so to say, that's starting to run on empty and perhaps even may start running on fumes, right? So, and this is a time where we have to talk about this because, this is where we find even those who are the caretakers, right? The care providers are starting to fall apart themselves. And so let's pay attention to the narratives in our own heads, right? That if we start to really imagine and agonize and stew about the worst case scenarios, then it kind of the brain uses a lot of habitual patterns, and it's almost like, think about like a well worn out path in the road, in the grass, right? That if you use the same path back over and over in the grass, you end up wearing it down, and it becomes like a well worn path. Well, that's similar to the brain circuitry as well, that if you keep on in those negative thoughts, right, over and over, what happens? It becomes what you do habitually, right? And so even though, this concept of like, well, maybe if I think about the worst case scenario that can happen, and I've already imagined it and conjured it, it may seem, and we call this, of course, the mental health folks know this, we call this catastrophizing, right? It may seem logical because it may be that, then I've already thought about the worst case scenario. And I've actually met people who have told me exactly this, where they say, well, if I've already in my mind dealt with the worst case scenario, then it doesn't seem so bad. But the problem is that literally zaps your mental capacity and reserves, right? And it just continues to build anxiety. And again, you may not see it right away at first, but it's happening internally, but what's inside eventually spills out, right? And I think that's one of the most important things to think about here. Now, for those of you who've heard me speak before, I'm really a big fan of talking about, the historical understandings of mental health, Islamically historical understandings. And we do a lot of research in the Muslim Mental Health Lab on pulling out kind of the primary sources of Islam, and how they spoke of mental health exactly, and how they conceptualized it, understood it, and had amazing advancements in classifying, diagnosing, treating, and of course, building the very first psychiatric wards within hospital systems and the very first standalone psychiatric hospitals in the world. And that's not coincidental. And it's very much connected to Islamic belief structures, which of course we could spend the whole lecture discussing, but I'll stick to the point, inshallah. But many of you know that I've published on somebody named Al-Balkhi, Abu Zayd al-Balkhi, from the 9th century, and really showed how he was, very, very early thinker and somebody who had already classified correctly so many of the mental health conditions. And the papers, that you can find in the Journal of Anxiety Disorders or the Journal of Affective Disorders talks about his discussions on OCD and his discussions on phobia, right, in the 9th century, well before millennium, before, this was even postulated and discussed in the West by Western psychology. Anyhow, it's very interesting too that in Balkhi's work, he talks about this concept of psychological resilience and coping. And so I'm highlighting those specific parts of his book today. His book is called Masalih al-Abdan wal-Anfus. Part of the book is translated today by one of the forefathers of Islamic psychology, Malik Badri, under the title Sustenance of the Soul, which is the second half of the book on mental health. And it's a tiny little manuscript. I encourage you to take a look at it. But in that book and in his original Arabic, of course, Al-Balkhi speaks about this concept of psychological resilience and coping. And he says something really actually very interesting. He talks about how just like, the body can be healthy or unhealthy, so can the soul. And remember, his book is the sustenance of the body and soul. So he's talking about both here. And then he talks about, he gives kind of almost like to make it easy for people to understand this. He says, just like the body can have, and it can have external, things that affect it externally, so can it have what affects it internally. And he talks about kind of like the example of external hazards, like for example, extreme heat or extreme cold, and says, what would you do? If it was very cold, you'd put on a jacket, right? If it's very hot, you'd take that off. And so he says, just like that, the soul can also be affected by the external and the internal and needs to be maintained externally and internally. It's a fascinating concept. And I think many of us in modern day, you know, clinical work might very much agree with this, where he talks about for the soul, for example, again, internally, first externally, he talks about you have to protect the soul from these outside elements. So, for example, whatever you see and hear, and you think about the pandemic, and think about all the news that people are consuming every single day, right? And they're consuming this kind of news that is terrifying, and numbers of people dying and vaccine, and we don't know what's going on, and you know, so on. I mean, there's just all of this that they're consuming all day long. And so he talks about these external components that are coming in, causing arousal of emotions like fear, anger, sadness. We need to actually protect ourselves. So when we come to the steps of what we need to all be doing, I'll speak about this point as well. Yeah, we have to have a certain amount of information to be, you know, knowledgeable of what's happening, but that endless reel is really problematic, right? Of news that's coming in. And sometimes it's not news about the pandemic, sometimes it's family issues, and sometimes it's, you know, work related issues. So talking about how to modulate that. And then internally, I love this as well. He talks about protecting your soul, your inside, right, from the internal symptoms of negative thinking. This, by the way, again, ninth century, okay? This is why I get so excited about this. And he talks about this concept of not having tea and coffee with your negative thoughts. And I love that. I love that. It's so fantastic, right? This concept of like, do not, you know, the negative thought comes to visit you, kind of wave them off at the door, and don't invite them in for tea and coffee. Muslims are so hospitable, they want to give tea and coffee to everybody. MashaAllah. All right. And so then he talks about, just like we have, you know, the internal, external to take care of, we also have two healing methods that you could potentially use. The first I really love so much, actually both of them I love so much, but the first, he talks about that in a day and in a time in which you feel kind of peaceful and tranquil. This is a moment or a day in which you should what? That you should really take stock of that and tell yourself, right? This, you know, kind of carpe diem, right? Like capture that moment, capture that day, and say to yourself in your minds, you know, in your mind, this is a good day, and take that moment and that happiness and safety and actually store it in a safe place, right? To pull almost like in a reserve, to pull from it in a difficult day, you know, in a cloudy day, right? And I think that's really a beautiful concept. And it's talked about by other Muslim scholars and of course by others as well. But this concept of like, keep almost like a, a reserve, a jar full of the happy thoughts that you can pull from when you need to. And then he talks about how you have to have an inner monologue. And I talked about this concept of inner monologue before. What is your internal or inner monologue happening? It should be one of what? Self-convincing. And what are you convincing yourself of? The Islamic belief is that this dunya, again, this world that we're in, is a world of tribulations. It's not meant to be a world of constant happiness. And if you seek out and want your life to have constant and everyday happiness, and you're constantly chasing the happiness, then you're disappointed, because that's just not how the world works. And so it's very pragmatic, right? And he basically says we should not expect what is not the nature of this world, again, according to Islamic theological beliefs. And so you're very balanced then in your thinking, and you realize there's going to be difficult days and dark clouds. And, I quote specifically certain ayat of the Quran when I speak about this topic to kind of prove my point. It's not in Balkhi's text, but just kind of me putting together some of the references from the Quran here. In Surah Al-Ankabut, we learn, the ayah reads, أَحَسِبَ النَّاسُ أَن يُتْرَكُوا أَن يَقُولُوا آمَنَّا وَهُمْ لَا يُفْتَنُونَ. Right? This is a really pointed question. It's a rhetorical question where Allah subhanahu wa ta'ala is asking and says, do people believe that they're just going to be left alone, meaning left alone, not being tested, right? Just because they say, we believe, we're Muslims, and they won't be tested? And this is a really pointed, theological belief, especially for those who say this in our community, unfortunately, where it's very much like, but we have Iman. Allah will protect us. And then they go out without their masks and they don't socially distance and they congregate and so on. And it's like, no, that's not how we do this, right? We believe that we will be, we do believe, but we also believe that we will be tested. And we're not immune from being tested simply by belief, right? Or by iman. Very important. And then also in Surah Al-Baqarah, Allah subhanahu wa ta'ala gives even more explanation to this, and he actually says, وَلَنَبْلُوَنَّكُمْ بِشَيْءٍ مِّنَ الْخَوْفِ وَالْجُوعِ وَنَقْصٍ مِّنَ الْأَمْوَالِ وَالْأَنفُسِ وَالثَّمَرَاتِ, right? And certainly we shall test you of something of fear and hunger and loss of life and wealth and fruits, right? And this is really key because that is the Islamic belief system, right? That Allah has told us that there will be tribulations. Why is all of this important? Because if you're trying to practice what Balkhi was saying here, or you're trying to have others around you practice this as well, really one of the only ways to be able to do this properly is to put things in perspective. It's the worldview. And if your worldview is a pragmatic worldview and saying, all right, God has said there will be tests, and each one will have different ones, and different people have different combination of tests throughout the course of their life. When you come to that realization, you are at a much calmer place of anxiety, right? And fear, because ultimately you say, you kind of like give it up to the divine, right? You kind of like rely on Allah, which is the next point here of tawakkul. This is something that is very key to the Muslim. Again, other faith groups potentially have this as well, but it's really important to kind of put this into perspective for yourself. Because again, you as the mental health provider or you as the faith leader, others are looking to you for support, and you can only give what you have. Let me repeat that again. You cannot give away what you do not own. And if you don't own a sense of tawakkul and reliance on Allah subhanahu wa ta'ala, you can't instill that in the person in front of you that you're trying to help. And if you believe that it's problematic to have these emotions that people are having of fear and anxiety, then it's also going to transfer onto the next person too. And here I speak more to the faith leaders and community leaders than I do to the mental health providers who, inshallah, are already on board with the concept of, yes, we have these emotions. Allah has created all of the emotions, including fear and anxiety and depression and sadness and so on, and has, given us methods in which to heal and to work on ourselves. So it's okay for things to not be okay. It is important for us to realize that we're not going to have happy thoughts all the time. And it's really important that we start to, again, this concept, this word uncertainty that I'm going to repeat over and over, to start to tolerate uncertainty. And one of the key ways in which you tolerate uncertainty is tawakkul, reliance on Allah. This is the concept that we call in Islam tying your camel, then relying on Allah. Right? And it goes back to a story of the Prophet Muhammad, peace be upon him, in which a man had, rushed into the mosque to pray without tying his camel down. And the Prophet called him back and said, "What are you doing? Why didn't you tie your camel?" And the man said, I depend on God. Like God will, take care of the camel. Right? And then he told him very pointedly, "I'qid wa tawakkal," right? Tie your camel, then depend on God. And for me, this concept of tying the camel it very much translates into today in this context, the hand washing, the sanitizing, the wearing the mask, the social distancing. Right? These are the measures we're supposed to be taking to what? Tie our camel. Then after that, there is tawakkul. There is a dependence on God, which is why you can't be extreme in either one of these. And anyone you work with as well, because sometimes I see this. I see people not just tying their camel, but they're like hamstringing the camel, right? They're like, obsessively washing everything and everybody and totally, just to such extremes that are not called for either. And at the other end, you find people who are totally into tawakkul. God will save me and take care of me. They're not doing any sort of precautions. But the Muslim is very much in the middle, right? And is very pragmatic in their thinking, inshallah. So instead of fighting the things that you can't control, take stock and take hold of the things you can control, right? And then allow then the rest to play out its course, inshallah. So we learn to then coexist with these unpleasant circumstances that are with us, and instead of trying to fit that circle, that square, sorry, the square into a circle peg, right? You keep on trying to fit it in to better it. Let me just better it, right? It actually ends up bringing you more peace of mind and of soul to realize that you can coexist, right? Uncertainty, tolerance starts to coexist with unpleasant and difficult circumstances. And this is the concept I've been talking about here of this uncertainty tolerance, how we're very much as Muslims kind of encouraged to believe and acknowledge that certainty only lies with God. And so for that reason, you find that in our study that I was telling you about, that actually, this is actually one of the most important points that came out of the study and very most interesting points that we found is that those who had a higher degree of uncertainty intolerance, like they were not able to tolerate the uncertainty, they increased their odds of suffering from major depressive disorder by 60%. And it had a clinical correlate by 60%. So there's something really key and important here to this point of uncertainty tolerance, and being able, of course, if you had that uncertainty tolerance, you're also more likely to engage in negative coping behaviors like, and worries, and financial worries also were also correlated with this. And of course, we're going to have to do a whole lot of more of research of really figuring out, right, how for those who had the certain uncertainty tolerance and used religious coping mechanisms, they were able to better their situation. So with that, inshallah, I'm going to, kind of take our discussion here in kind of this last part of our discussion of kind of running through some of the main coping mechanisms that we have found, both in the research that we've been doing, but also in the work in general. And here I'm going to focus in on, again, our leaders, our mental health practitioners and our community leaders. I've really, think about this, of course, for all the people you serve, but especially think about these next 5 steps for yourself. Right, that original slide up there that said, practice what you preach, right? This is really important, talking and listening. Now, it's amazing how many of us in this room right now have people who talk to us professionally or daily, or that is our job, to have people talk to us and for us to listen. But are we talking to somebody who's trustworthy? Is anyone listening to us, right? Especially as you carry the load you're carrying for everybody else. And I think that's really important here, that you find, this idea of bottling up the emotions, as you know, or at least our mental health providers definitely know, it's people really start to believe that if they just bottle this all up, that's a show of strength, right? They're not complaining, and they're not, but the reality is this is unfortunately one of the unhealthy coping mechanisms, and it's really important to express yourself. And this can look as simple as, communicating with your colleagues, for example, and just honestly saying, it's been a rough week, have your clients also, especially when the elections were going on here in the US, it was like nonstop. Like it was like I'd get out of one session into the next, every single session, just that. I was like, oh my goodness, it just, and so, express yourself and say, whoa, that was, is anyone else feeling this too? And then suddenly you find all your other colleagues are going, yeah, me too. Yeah, this is true. Yeah, me here too. And that sense of like, okay, I'm not alone in this, right? That sense of normalcy. And that's just one example. You can fill in the blank here with any example, right? But being able to express yourself in order to be able to just even hear that others are going through it too, right? To remember that everybody actually deals with the challenges that come their way differently. And it's actually perfectly fine to deal with them in different ways, as long as they're healthy ways of coping, of course. In this virtual world that we're all finding ourselves in, is difficult. Again, unless you had already been a pro at online everything, teletherapy, online learning, buying your groceries online, I don't know, just everything that's online. This is still different because, you must have been the unique one amongst everyone else at that point. But certainly for everybody here, these are challenging and very different times. And I really encourage us to make sure that we're taking stock of the talking and listening. Number 2, and I promised I'd come back to this, of moderating our news intake. And this includes us as well. Now, interestingly enough, because I'm actively in therapy and clinic, I I feel like I get enough news from my patients, right, who are talking through all these things. And I don't even know if I need to really even tune in much at all. But the reality is, whether it's the actual news or whether it's social media, this idea of constantly being plugged in actually means that there is quite a bit of problem in terms of, overload of our mental capacity. And if you compare us to our forefathers, they did not have this constant, right? Constant, stimulation from the news and information. Also, you think about the large amount of time that we're on the screen. Even if it's for work, it's like, but I have to do this. Right. Yes. For school, I have to do this. But the reality is, when you take breaks, and you need to take breaks, and we're going to talk about breaks in a minute, the breaks need to be non virtual. This is so key and so important. And often people say, okay, I'm done with my session, or I'm done with writing my, notes or whatever it is. Now I'm going to, surf the net or whatever, surf my, Facebook page or my, Instagram account or whatever. The reality is, you need to unplug in your breaks. So go take the walk, the bike ride, right? Go and meditate. We're going to talk about some of these in more depth in future slides, but just, right, they have to be away from we need to break the virtual bubble. I had shared with some people earlier how one of my teachers, this is way before pandemic, I mean, years and years ago, one of my spiritual teachers, she would say to us, you need to get out every single day, and touch the leaves. And back when I was younger, I would think, what if, it sounded very like hippie, like, well, like what, touch, hug a tree, that kind of concept. And I was like, huh, but especially after this pandemic happened, she said this again more recently and said to us, remember when I would always tell you guys, go touch the leaves? We'd say, yeah, yeah. Now in your virtual bubbles, it is even more incumbent on you to break break that virtual bubble and touch something real, like the leaves, the tree, the grass, the something, to break free of the bubble that we find ourselves in. There are people between their work and their school and the socializing with their friends and family. They're on a screen of some sort all of their waking hours, literally. And even while they're eating, they're still in front of a screen watching something. And even when they're, socializing, I mean, it's like think about it, take stock of this, right? So this idea of like, leave that, this is why I love, subhanAllah, the idea of like the prayer, where in Muslim prayer, you have to be in a place and you have to be in a zone in which you cannot talk to anybody, hear anything else, engage with anything else other than your prayer. You certainly can't be on a screen in the middle of your prayer, right? And it's purposeful, right? It breaks the cycle. And I think that's really key to what we're talking about here. Now, for some people, number 3 is going to be really key and important. And this is what I call take action, be actionable, action-oriented. Because for some people, they hear this whole lecture and they're like, great, wonderful, sounds good. But I'm feeling that itch, like I have to do something, right, about this situation. And that might speak to your language, right? The language you speak might be the language of service. And if that's the case, then find ways to help others, right? Be part of all of the community wonderful helping kind of mechanisms that are working on creating the meal packages and the care packages and the grocery runs for the elders. And, most local communities, there are things like this happening. So if it helps you to take action into your own hands, do that, because it actually helps lower that anxiety, because you feel like you have a sense of control again over a very difficult situation, right? Now, this one I said I would take, speaking of taking time, that I would take the time to go into this one in much more depth. And it's important because it's basically, we're talking about this life-work balance and how it's, like we said, everything is in this virtual space. And how do you incorporate self-care? Well, part of that is making sure that we are actually sticking to the routines. Remember earlier I said how the 5 daily prayers are so interesting in that they give us a sense of normalcy and routine. In these, if your day revolves around 5 prayers, right, and you do things in between of your 5 prayers, then they kind of like hold down the day, right? I used to have a spiritual teacher, who would say she felt that prayers, the Muslim 5 daily prayers, were like it was like a carousel ride. And what she meant by that is, that the day is rushing through, just so much going on, and it's like you're on this carousel, kind of all just spinning, 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 spinning all day long. And then suddenly it's like somebody, when the prayer time comes in, it's like somebody presses pause and everything just stops and all the world kind of shifts back into focus and you pray, knowing that after a few minutes of that, you're going to have to get back onto the carousel of life, right? Just the spinning that's happening. But then 5 times a day, it kind of pauses and you're able to see the world and it kind of shifts back into reality of the world, right? And I love that example. And it really helps me actually think about what these prayers actually mean for us. And then there's all the other parts of our routine that unfortunately in quarantine, we're finding people not actually doing a good job with, right? Exercise. I mean, yes, the gyms are closed, but there's ways, of course, to exercise. And I'm not going to belabor that other than to say, be creative, right? Especially those of you who are serving others. Um, Health, everything we're telling others, right? The healthy eating, the healthy sleeping hygiene, yeah, sleep hygiene, right? Making sure that we're taking our showers and taking our breaks from the screens and so on and so forth. In addition to all of that, there is also the spiritual mechanisms of really making sure that we are taking the time to refill our voids, essentially, right? To refill that car. And for me, other than the 5 ritual prayers that we do daily, the Muslim observant Muslim would do 5 times a day, add to that. Add to that certain things that are what I call kind of indigenous practices from the Muslim faith into this, into the work that you're doing. And, the concept i'tikaf or spiritual seclusion is something, of course, that's well known in the tradition, the Muslim tradition, often practiced in the mosque, particularly for the men. The women here are in better shape in the sense that they're able to do i'tikaf, the spiritual seclusion at home. But for both men and women, they can engage in the second word, which is called khalwa, also known as a spiritual seclusion. It just does not have the same criteria and the need to be in the mosque and so on. You can do this really in a corner of your home. So we have the prayer rug here in this picture because it's almost like you only need a prayer rug size to do this, okay? Where you're literally just putting a prayer rug on the side and you are of a corner of your home and calling it your sacred space. I can't tell you how much I encourage this and how much it is actually very practical because again, if you're praying at some point in your day, you need that prayer space anyway. And it could just be that prayer rug size in a corner of your room, your office, your house, your, somewhere that you're staying. And you're going to kind of put that there. And every time as you go to your prayers 5 times a day to pray, in addition, what you may be doing is really these indigenous Islamic concept of meditative, contemplative, meditative practices. And for me, that has been so key. I can't tell you how key it's been to help relieve pressure and stress. So I'm kind of sharing it with all of you. And people have asked often, how do you do this? How do you do that Islamic meditative kind of and contemplative meditation of tafakkur, and tadabbur? And some of the ways, to think about this is one of the key ways for me that I tie it in order to be practical. I tie it to my 5 daily prayers. So as I go to pray my ritual prayer, when I can, I also pause for even just a few more minutes because then there's, the people then say, well, when in the day can I finally do this? Well, it's like, well, if you are somebody who does happen to pray those 5 daily prayers, just tie this to it because it works very well this way, right? You're already there in that sacred, corner of your home, okay, if you will, putting your prayer rug there. And you're going to go ahead and contemplate on what. So this is different than the meditative practices in which you free your mind of all things. This is actually a contemplative meditation. And it's important and helpful because there's just so many thoughts racing in our heads. I know for me, there's just a lot going on. And even in prayer, even when I try to concentrate in prayer, there's just a lot going on and you have to like really focus in, right? In order to stop all the noise. And so what's really helpful in meditation, of course, is being able to put yourself in a place to center yourself to be able to stop all of that noise. But in contemplative meditation, you're actually inviting the thoughts in, right? It's a different kind of meditation. You're inviting the thoughts in and you're actually regulating them. So let's say a thought comes in. There's this microscopic virus that we can't even see has brought us all to our knees. Okay, so you take that point and you say, all right, and you kind of contemplate it through. What is the purpose of this, Ya Allah? Why is this here? How, oh Allah protect me and my family, right? And you're kind of going through what different thinking process and even prayers and asks, right? Of being able, dua basically, right? Supplication to be able to kind of modulate that fear based thought that you had there. You have next, you bring to the forefront of your thinking. Allah has said, that with every illness that we have, that there's a certain amount of purification that comes with it. And you think about the hadith, which I put here, no calamity befalls a Muslim except that Allah removes sins from them, even if they were pricked by a thorn. And the pandemic is a whole lot more than a thorn, mashallah, right? So you think about, oh, wow, this can also be like an expiation of sins, right? So what are you doing here? You are cognitively reframing the thoughts that are coming in this contemplative meditation that you're doing. Then you might actually add to it. So what do you do next with that? Then maybe you add now some spiritual, what I call spiritual aphorisms, right? Where you basically say to yourself over and over, almost like in a dhikr, right? And almost like dhikr is a remembrance of God, right? And a dhikr, or like just like how you would say subhanallah, alhamdulillah, la ilaha illallah, Allahu akbar, right? The way we might after prayer, if you learn this tradition that you do after prayer 33 times, right? You can also do something similar with certain concepts. And I'll share some of mine. Some of the ones that I personally do is, la yukallifu Allahu nafsan illa wus'aha, right? That Allah does not burden a soul more than it can bear. And I kind of tell myself that over and over, right? Right. If I'm feeling really burdened that day, to kind of remind myself, again, taking from my faith, kind of remind myself that Allah is not going to send something my way without helping see me through it, right? And kind of like reminding myself that almost in a dhikr meditative state. Sometimes I say to myself, "قُلْ لَن يُصِيبَنَا إِلَّا مَا كَتَبَ اللَّهُ لَنَا," right? That nothing will ever befall us except that Allah has already written it for us. And then it helps me kind of like really kind of center myself and say, all right, this has been written. So, and Allah's going to see me through this because he's not going to burden me more than I can bear. And so therefore, right? So you see what's happening here. It's kind of a contemplative, meditative state. And so many of the Muslim scholars of the past have actually spoken about this concept. And it's unfortunately missing from many of our current practices. For many Muslims, even observant ones, will say to you that they go to the prayer rug, kind of rush through their prayers in order to like check that off for the day that they, right? And there isn't a whole lot of time to just sort of like sit with it and center yourself with it and contemplate and meditate on this and kind of refuel your spiritual voids. And so I really wanted to kind of share this. There's so many more. By the way, we probably could have spent the entire lecture talking about just different kinds of dhikr, tadabbur, tafakkur, and so on and so forth that's indigenous to the Muslim practices. And I think it'd be helpful for you as people who are, again, Islamically, we have this belief that faqid of shay la yu'ti, that a person who does not have something cannot give it. So if you don't have some of these own meditative kind of practices, and yet you're going to prescribe to your patient or client, right, meditation, they're not going to do this either. Or maybe they'll do it to some extent, but it's not the same as when you yourself have one of these practices and you're able to say with very certainty, this works, right? And so I really want to kind of make sure to say that and to, remind us how important it is, the amana or the responsibility that we have been given, right? This is a gift. And I want to make sure that you have that. And so my last kind of slide, of course, I can't end a conversation like this without saying number 5, which is the concept of getting help. Again, going back to let us practice what we preach, we're telling everybody around us this is difficult days and difficult times, get the help you need. But the question is, are we getting the help we need? And, and this is, I really want to think with me, please take a moment to think with me about this slide here, what I'm saying here, that if the self-care tools that you have built up over time, the tools that are in your toolbox, aren't quite enough to help manage your levels of anxiety and fear, which are normal, and are acceptable, okay? But if they're not enough to self regulate and to self manage, then it is time, as you know, for professional help. And so for many people, they'll ask the questions of, they'll check in with themselves and say, Do I feel bad? Well, the reality is we all feel bad. That's not a good enough of a question, right? The better question might be, would it be helpful to talk to someone? And if the answer is, yeah, actually, it might be very helpful to talk to someone, then that is your answer of should you have your own counselor and therapist, you know, help you through this time, especially as you're helping others, right? So with that, I'll leave you then with a couple. I said I'll start with resources and end with resources, and leave you with some different. I referenced a couple of different publications during the talk today. The first two here, I'll just say briefly, have already been published. I'm very proud of them. The Islamophobia and Psychiatry book was published last year in 2019, and the Applying Islamic Principles to Clinical Mental Health Care. Very proud of this one. Was published this year. Both are available, one on Springer and one on Routledge. I think also both are available on Amazon. I referenced the book that is coming out soon about Islam, Muslims, and COVID-19, where our study on the lab and Yaqeen together is coming out in this book sometime next year. I'm also working on the textbook on Muslim mental health commissioned by the APA, or the American Psychiatric Association. And so hopefully we'll have, even there's a lot more research happening right now kind of to build up this book. So maybe expect that, inshallah, sometime. I think it'll be 2022 when it's ready to be out. And I didn't talk about the topic of suicide today, but it's really key and one of the core lines of research that I'm doing in the lab at the moment. And kind of really working on making sure we have proper guidelines for not just prevention, but also intervention and postvention specifically. And so I hope you'll find those resources helpful, and you have the contact here to the lab and how to follow us. And I thank you for your time today, and I hope this was useful. And inshallah, we can open it up to questions from here. Barakallahu fikum.
Jazakallah khair, Dr. Awaad, for this amazing talk, very compassionate, reminding us to look for silver lining, practice what we preach, and tolerate uncertainty, and take care of ourselves first before taking care of others. So fill our tanks. Jazakallah khair. We have a couple of questions and a lot of enthusiastic response to your talk, alhamdulillah. I want to start with one that had been sent to us prior to even your talk. People will really looking forward to having you here today. And it's about the very special role of being an interpreter and cultural broker for your clients, and where to draw the line between what is known to be kind of some of our traditional explanatory models in Islam, being, for example, lams, hasad, jinns, and the different mental health issues that we see in our client, especially when you're an interpreter and you're kind of in this intersection of putting your client in feeling like that they can trust and can tell the psychiatrist, but they don't want to tell the psychiatrist, and you don't even know like what to hold true and how to help your client better.
That's a great question, actually. The question of the interpreters. Thank you for bringing that. I think that's really wonderful. I don't actually think that's been asked in a setting like this before, so I really appreciate that. And we have an entire, in one of the classes that I give to our PGY 3s, it's our psychiatry residents. It's on the topic of culture and religion and psychiatry, and the topic of interpreters specifically comes up in that class. And we actually spend a whole session talking about it because, and I won't belabor it here, but I will say that it is so key, and the work you're doing is really important. And I very much can sense your own kind of anxieties grappling with do I say exactly what the client is telling me? Do I try to what is my responsibility here? Do I try to coded in words that the psychiatrist will then understand if they're not from the same cultural and religious background, and so on. And of course, first I'll say, kind of just as a disclaimer, of course, your job as a interpreter is to, of course, make sure that you are saying exactly what your client is saying, even if you don't agree with it or it doesn't sound right. It is especially important to use the words that they are themselves using. And then I'll explain to you what to do with that. But, so if they are saying ayn, sihr, jinn, right? So like translating that, the evil eye, magic, or jinn, or, supernatural kind of possession, then it's really important to actually talk about that, because it's important for the psychiatrist then to then be able to ask the question, what does that exactly mean? And if the question, if here, let's do this so we can see each other better. If the question then means, if they mean exactly what that, if what they're saying there, which is basically, yeah, I really do believe there is jinn inside of me. It's really important that the psychiatrist then is able to assess, a couple of things. Of course, the psychiatrist may be thinking pathology, so thinking psychosis, right? Hearing voices, communicating with something that's not there, and so on and so forth. Um, but at the same time, the treatment that is then used would be also very important, because don't basically, I'm trying to say as an interpreter, don't rob for the opportunity to be able to have that um, psychiatrist or psychologist then be able to have a cultural consultation with the community, to be able to say, with leaders of the community, to be able to say, should we bring in your faith leader, for example, if you feel that you really want to have, somebody read Quran over this as well, all while we are working with you psychiatrically, right, for these voices that you're hearing or this situation that you're in. So, I mean, I know that's really difficult. And sometimes you yourself may not even believe what is being said or don't know exactly what to say. But it's really important to say it exactly as is, and then encourage, right, that there actually be beyond just, this is what we call holistic care, beyond just allopathic physician or osteopathic or however, physician taking care of just looking at meds, kind of like pathology, and the faith leader who may be able to also be a person of who has rapport with that patient, who can actually also be a broker, right, and bridge the gap. And maybe what that person needs is a two-pronged approach, where they're getting their psychiatric treatment, we hope, and then in addition are also getting, put on read by the imam or someone, a sheikh. Let it be, so basically your role unfortunately is not one of authority in any of these. It's really to broker and make sure that all of that is sort of happening. So I don't know if that answers the question, but I hope that's what you were getting at, inshallah.
Khaira, I think the person just added that what's difficult is to convince the client to actually talk about these experiences with a psychiatrist, because they are scared to be judged and all of this. And often it's done after, like, they're confined, because interpreters often follow those patients, they confine in them after the actual consultation or in between, and not during the actual interpretation.
Hmm.
I think
Yeah, no,
that's
I hear
very
you
hard.
clearly. I hear you clearly. And that, I would say that that speaks to the trust that and rapport you've been able to build up, which is really wonderful. The question then comes, what do you do with it, right? What is the responsibility to do with it? And this is where you might say to your client and say, basically permission, asking for the permission to be able to say this directly. And of course they would be fearful, because the fear of being judged, the fear of being medicated, the fear of being all these things, right? Diagnosed in some way, they to alleviate the fears as much as possible, because we hope that the psychiatrist is somebody who's culturally competent and able to look at the issue from more than one perspective, and understand that there are cultural and perhaps faith-based issues that are coming into the discussion here. Um, and also a reason why sometimes it's very helpful to have people who are of a similar background, because it just makes the gap a little bit shorter. right, right, it kind of bridging it a little bit easier. But nevertheless, your job is a difficult one, and your role would then to be to seek out and say, look, at our next appointment, would you allow me to, and maybe explain the benefits of how that could actually be the help they need at the end of the day.
Jazakallah khair. It's a very uh, good answer to a very complicated question that can take a session by itself. Alhamdulillah. We have a question here about how can you integrate mental health counseling and religion with kind of adolescents that are born and raised in Western countries, and as parents, is COVID a good time to start integrating more Islamic way of life?
Sorry, I didn't catch the first part. So it's about integrating Islam in COVID for children?
Yeah, for adolescents that are born and raised here, how do you integrate Islam in part of your counseling?
Yes. Um, oh, this is a counselor asking.
Mhm.
Yes, got it. Okay. So the integrating part is an interesting thing. I mean, the work you saw, probably the book I just put up, we have this book on, Islamically integrated psychotherapy, working with professional psychiatrists, psychologists, therapists of all backgrounds, but of integrating Islam into the, the therapy process. And what we meant by that was really, taking the framework of Islam in order to bring that into the therapy process. Inshallah, you have the whole book to access to kind of learn more about what we mean by that. But in a nutshell, um, you know, as a therapist, it's really important to make sure that you are actually allowing the client in the room to guide what it is they're looking for, because we are very careful. I mean, you may know that I also work with the Khalil Center out here in the Bay Area, and you have one in Canada now, which is a center for Islamically integrated psychotherapy. And one of the things we always say to our therapists is never assume, as a person, even a young person, even an adolescent, as they come into the room, um, you always ask, what is it that they're looking for? What is it that they want out of this? And if they want nothing about Islam into that process, then no, it should not be brought up, you know? And if they do want that and they're actually actively seeking it out, which I find that actually I would say the majority of my Muslim patients and clients and families are actively, the reason they sought me out was for that reason, right? Um, and if that is the case and they welcome it, then yes, certainly you can bring, especially like I mentioned, sometimes it comes up in the forms of like, other than prescribing kind of a secular meditation, why not prescribe an Islamic based one, right? That's more familiar and maybe is much more easily integrated into their daily life, right? Sometimes it comes up in identity, right? As a Western Muslim, right? Whether it's American, Canadian, et cetera, like a Western Muslim, how are all those conflicts of the different identities you hold kind of coming into play? So yeah, absolutely, especially in adolescence when identity formation is really happening and at an all-time high, right? It would be a wonderful time for you as the counselor to really work with that person through those things. But it's also really key that it's as much as the family, sometimes we find that families, parents are like, help my kid be a better Muslim. And the kid's like, I'm not interested in this right now. So you're kind of working with them from a place of like what they need, and very much like, why is that? What is challenging? What's happening? Just kind of finding that ground. And eventually it may be that actually the reason they're so turned off from all of this is maybe because they've experienced a very Islamophobic attack, from a friend or something. At that point, you might, it starts to then all sink in and make sense. But the most important thing I can say here is never go in assuming anything, that just because you're a Muslim and they're Muslim, therefore Islam needs to come up. Let it happen organically, and importantly, that it be patient led.
Jazakallah khair. We have a question about the word self-care, and that often when presented, especially to Muslim women, it makes them feel that if they do self-care, it's selfish. And perhaps maybe there is a better term, or how to kind of sell self-care to Muslim women better.
That's a great one. And I know exactly what you mean. The problem is this part about selfish and whatnot. This is very cultural constructs. For me, as you see, I'm not talking from a place of culture. Very much talking from a place of religion and faith. And and I remind people that this is not a foreign concept in Islam. Like if and again, putting culture aside for a moment, what does the Deen say? What does Islam say? And it very, very specifically says, right, that we must, right, that we are first and foremost responsible for ourselves before we're responsible for anyone else. One of my teachers would have this really beautiful discussion of the concentric circles. If you've heard me speak before, you might have heard me speak about this concept where very, very quickly, spiritually and theologically speaking, your relationship and the core is your relationship with Allah subhanahu wa ta'ala, and the very first thing you're asked about. Then comes your more immediate family. So if you're married, that's going to be your spouse and children. If you're unmarried, that's your parents. And then the circle after that would be the parents and the siblings. After that would be your extended family. After that would be your colleagues and friends and so on. After that, your community. After that, national. After that, international. The ummah, right? We have this idea of these circles, one within another, in terms of what are your priorities and what does Allah subhanahu wa ta'ala ask about first. And what he asks about first is you and your well-being first. And this is so core. So for anyone who says that's selfish, well, the reality is certainly Allah doesn't think so. And that's why he asks about your own prayers and your own connection and your own actions. And we learn theologically speaking that on Judgment Day, no one stands with you. Not your friends, not your spouse, not your kids, nobody. It's just you. And you answer for your own actions. And so for me, when people say that's, self-care is selfish, it's like, right, but I'm going to be asked about my kids, but not until I'm asked about myself. Do you see what I'm saying? So for me, it's again shifting things into priorities, understanding this deen of ours better. And again, I find it to be a very pragmatic religion.
It's probably going to be the last question. I apologize for the people who've asked a lot of questions and we don't have enough time to go through them all. Um, we have a question about the fact that you have put the accent on the fact that negative emotions are created by God. Are our responsibilities toward changing our behaviors of those emotions? And how do we empathize with the different way people live this emotion, be it somatic, with anxiety, with the many different reactions of people?
So sorry, just so I understand the question, that we had talked about how all different emotions are created by God and how
Is our
to,
responsibility to change our reaction to them
oh, yes, okay.
and how to empathize with people's reaction to their emotions?
Yes, yes. Very, very, very good question. And so, yes, Allah has created all of these emotions, yes. But He's also asked us to modulate emotions. And this is where it becomes part of not only the requirements, but also the sunnah, right? The sunnah meaning the blessed way of the noble prophet, Muhammad, peace be upon him, of, of having the message come in human form, right? In the form of a prophet who had, full on behaviors and characteristics and so on to teach us, right, how to kind of be better in the world. And I have a whole other discussion on this in which it's basically looking at how did the Prophet Muhammad, peace be upon him, deal with the various actions of the people around him, right? So when the person who is angry or the person who is crying or the person who is wailing, right, because somebody has just passed away, or the little child who has lost their pet, we actually have hadith that talk about each and every one of these different scenarios, and then you see actually the prophet's reaction to that and the advice that he gives to the people around him about how to work with those reactions. This is twofold and very important. The first is, how do you react to an emotion in front of you, right? Whether you're the therapist here, whether you're even just the community member, whether you're the mom, like whoever, whatever role you're playing in that moment, how do you, react to the emotions that you see coming out of that affect that's coming out of the person in front of you. And it's so beautiful and so gentle the way the Prophet Muhammad, peace be upon him. There's so much to say here, but this is what I'll tell you. On Monday, inshallah, there is a full episode. The lab worked with the Yaqeen Institute to do a whole series actually on the topic of mental health and the historical understandings of mental health in Islam. And a lot of the questions, I didn't get a chance to read all your questions in the chat box and such, but I'm catching just a few of them. And it sounds like a lot of people are asking, how do we bridge that? How do we know our tradition? How do we explain to people this mental health story? I hope in that series, it's a 6-part small clips, right? That they'll be released once a day, every day for the next week, inshallah, starting Monday. And I go through this exact point. This is what reminded me of it. I actually speak about the prophet's emotions, not just his own, but even other prophets, and how they had sadness and how they cried and how they grieved and how they, but it was a modulated emotion. And I'll give a very quick example of this and then turn you towards the series, inshallah, that hopefully you can benefit more. And for those who are asking about how do we bridge with the community, I really do hope the series will start to do that, because it talks about everything starting from the prophets themselves, right? And kind of goes through kind of that Islamic, very, very rich legacy and history related to mental health that often, unfortunately, we don't know a whole lot about. But in a nutshell, if you take the example of the Prophet Muhammad, peace be upon him, when his own son died, Ibrahim, and he was a young child in his lap. He's crying. He actually starts to tear over him, and the Sahaba around him saw the Prophet tearing and actually questioned him and said, you're the Prophet of God and you're crying, like what's happening here? And they're also trying to figure out, like, is it okay to show emotion? Like, is this normal? Like, do we go with this? Like, what's happening? They're also trying to figure out. And he has this very beautiful statement where he basically says, the eyes tear and the heart feels sadness. But we do not say other than what pleases Allah, right? Like we fully accept the qadar, or the fate that has been given to us. And we do not say, right? It's very careful, like in anger and kind of like upset and how dare this happen, right? So it's like, yes, you tear, and yes, you show emotion. And it is okay to do so, right? But you're very careful and modulated in not also kind of going to the other extreme of wailing, or the other extreme of like, detesting this so much that you're pushing against it. And then he says, and to your departure, O Ibrahim, Ibrahim's taking his last breaths. He says, and to your departure, O Ibrahim, you know, we will feel much sorrow. And all throughout the Sunnah of the Prophet, sallallahu alaihi wasallam, you actually see this, you know, acknowledgement of emotions. You don't see a shaming of emotions. You see a very kind of gentle approach with it. And you also see a reframing that happens. And if I had time, I'd actually go through another example of the little boy who lost his pet, and how the Prophet ﷺ kind of helped him reframe the way he was thinking. Again, there needs to be a whole discussion on this. Probably books and books can be written on this, right, concept. And again, for those of you in the mental health field, and even for those who are not, but are friends and allies to mental health, inshallah, it is really important to know that this tradition is so rich with this, and can really guide the way we work with not just our community members, but ourselves and even our own children, but certainly those we serve as well. I hope, inshallah, that was a beginning of a conversation that I hope will continue. And it was hopefully a hopeful beginning, inshallah.
Inshallah. And we put seeds in people, and inshallah they'll continue and pursue more knowledge, like Dr. Awad said, with yaqeen. And for clinicians asking for more training, I encourage you to follow Khalil Center